I'm Dr Shagun Aggarwal. I'm a specialist plastic surgeon and I work here at the Sydney Adventist Hospital and also at Royal Prince Alfred and Prince of Wales. Before I even went into medical school, I was someone whose hobbies were to do art and painting, and the other subject that I really loved, oddly enough, was design and tech. And the reason I liked that was it paid attention to detail, and one of my favourite subjects within that was doing electronics and working with circuit boards and things like that. I did always have an interest in science, and I knew I wanted to do medicine, but at that stage I was sort of someone who wanted to be a doctor, but I wasn't sure quite what sort of doctor. When I went into medicine, one of my subjects that I really, really enjoyed was anatomy. And it was just like a light bulb went, and it was like, I think surgery is going to be the place for me, because it combined my interest in anatomy, but also it allowed me to do something with my hands and allowed me to pay attention to detail, the things that I really enjoyed. As a junior doctor, I sort of tossed and turned about, what sort of surgeon am I going to be? To be honest, I didn't even know what plastic surgeons did or, what they were about. But once I did get to find out, I just thought that this was me. And the reason it was me was it allowed me to be a bit creative, allowed me to be a bit artistic. I could operate from head to toe. I could do something with my hands. And I do think plastic surgery is something that, you have to pay attention to detail. And it's a very visual specialty. People can see the difference between, someone's work and another person's work. I think, even from just what you do in the operation to the dressings you put on, it really makes a difference what sort of a surgeon you are. And I do really, really enjoy the visual aspect of my specialty. I feel that it's so satisfying. Just knowing that you've done a good job, I can see it for myself. So, a breast reconstruction patient who comes to me without a breast, and they end up being so thankful because they look great, but I didn't need them to tell me that. I can see, the difference I made to their life. I think that's all of those reasons, why I did plastic surgery. In plastic surgery, we sort of deal with everything that's aesthetic or cosmetic and function, but the two go hand in hand. We say form and function, and without those, I don't think you can have one without the other. And so, yes, on one hand, we're doing something to improve someone's appearance, or even from a reconstructive point of view. We just said, for a breast reconstruction patient, we might create a breast. But I think if you just focus on that, we've sort of missed the point. If someone who's a breast cancer patient, the horrible disease that they go through affects all of, not just them, but their entire family. And unfortunately, it keeps affecting them on a daily basis even after they've gone through it. So by restoring the breast, yes, it's cosmetic, but it regains that woman's, I guess, femininity. They're allowed to be a woman again. They're allowed to be normal again. They're allowed to wear the same clothes again. They can interact with their friends and family in the same manner that they used to. And yes, on one hand, all we did was just create a breast, but it actually changed their life. I think for other domains, it's even more apparent. So someone who has a head and neck cancer, and we replace, part of their tissue that's been lost, whether it's part of their tongue, part of their jaw, part of their soft palate, whatever it is. And I'd argue in that sense that the function's even more important. Those people, almost don't care what they look like, but they really want to be able to talk and swallow and be pain-free. And we give them that, and I think that's a real advantage of plastic surgery, that we've got the capability of restoring that form as well as function to give them their life back. I do reconstruction in many other ways. So, someone who's been run over by a car and they've got a big orthopedic injury of their leg. The orthopedic surgeons, I don't know anything about fixing big fractures, but once they've done that, they can't get on their feet without having appropriate soft tissue cover over that. And if you don't provide cover, the metalwork can get infected, they can have big complications. And if you cover that in a timely manner, those people recover very quickly. So again, it might appear that all we've done is made the limb pretty or, made it, normal again, but it's actually very much at heart that we've improved the function. And I'd argue that a lot of procedures we do are all life-changing.